Great. Hello, hello. Great. I can see people having very animated discussions. I'm hoping they're on climate change and not dinner and plans thereafter. So let's call our session into order. I think we have everyone that we need in the room right now. Welcome all to today's session. Our session today is on Pan-African Multilateral Partnership on Climate Change and Health. And I'm pleased to see that we have a full room and that you've all made time to be present here today. From the outset, I'd like to appreciate all the partners who've made this possible today. We have AMREF, who are supporting our convening today and have done a lot of work in Kenya and across Africa when it comes to climate change. And so we appreciate you, AMREF. I can see some of the experts when it comes to climate change. And I could hear Dr. Maria saying that this is self-promotion. No, it is not self-promotion. Kenya is happy to take the mantle when it comes to climate change. And Kenya, yes, is one of the co-hosts of this event. I do also take recognition of different governments who are represented here today. I'm informed we have Malawi represented here today. I'm informed we have Nigeria represented here today. And we will be waiting on Egypt and other countries to join us. So welcome to our session today. We shall begin with introduction and setting the tone, and I'll be doing that. My name is Dr. Masi Mwangangi, and I work in the Ministry of Health in Kenya. And we shall then have our keynote speech from our keynote speaker, my minister, Senator Motai Kagwe from the Ministry of Health. And thereafter, we shall have a panel discussion, our first panel discussion of the day. And Dr. Maria will be able to moderate that for us. We have a good selection of panelists who are all experts in climate change, but more importantly, experts in the nexus between health and climate change. And so we'll be going through a panel session there where we'll be debating and sharing ideas, interventions, what has worked, what hasn't worked, and where the gaps are. We will then have a second panel. We'll have Liz Ntonjira champion this. She shall moderate this. Again, we have experts in climate change. And in this second panel, we'll be focusing on the role of youth and women, their contribution to mitigating against climate change. So get ready for a very animated, exciting session. I shall call out on you if I see you praying for us or praying for supper. That means sleeping or yawning. I will bring the mic to you for you to make a contribution. I'm just threatening anyway. So really today we're here on the backdrop of the just concluded COP26 in Glasgow. I do see familiar faces. I was in Glasgow myself as part of the Kenyan delegation. And I think that meeting perhaps laid a platform for different countries to make commitments when it comes to climate change. But what was so special about COP26 is that for the first time, health was put on center stage when it comes to climate change. Those of you who've participated in different COP meetings, and I seem to remember a COP meeting that took place in Nairobi, Kenya, even then in our home country, there was no discussion or center spacing of health. And it's clear that health perhaps is one of the most vulnerable sectors when it comes to the climate change. Yes, health is a contributor to it, but perhaps when things go wrong, when it comes to Mother Nature, health is what would be affected most. And I can tell you, and my minister will share examples of what is currently going on in our country back home in Kenya. And what is interesting is that this is a situation across the world. We are just off or getting to the tail end of a pandemic that had its effects on climate, that had its effects on mortality and morbidity. And now, even with new threats of new pandemics, threats when it comes to environmental disasters, emergencies, when it comes even to displacement, when it comes to health security, all these are factors that have a nexus when it comes to causing negative impacts on climate change, but as well as affecting our very vulnerable health sector. And so we're here today to converse, to debate, to come up with perhaps a reflection on where we are, particularly as an African continent, but then additionally, perhaps then what we need to do, the political support that we need to mobilize to be able to actually put resources on the table when it comes to climate change. I must say Glasgow was an eye-opener for myself. In our ministry, we are working on different interventions when it comes to climate change and working on the first strategic document that would actually lay a frame of what we need to do when it comes to adaptation and mitigation. And so I thank you all. This is an open session. I usually do encourage people to really air out and ventilate what they have in mind. And so with that, and with those few remarks, I would like to introduce to you the Cabinet Secretary in the Ministry of Health, Senator Mutahi Kagwe. There are many jokes I could tell you about the senator here. I'm not sure which one I should start with, but the one thing I must say, having served under him for the past few years, and particularly him being the ambassador and the champion that has, steered Kenya through the pandemic, he always says two things. The first thing is that our objective in the health sector is to put a smile on the patient's face. And today he repeated it in the morning. We have no other objective. We have no other cause. We have no other purpose than to put that smile on our patient's face. And there are many ways in which we can do that. And today, as we discuss some of the internexuses between the environment and climate change, then that's very clear, particularly for our own country where we're battling droughts, of course, issues of malnutrition, and of course, interventions that are needed in both ways. The second thing that you may not know about the minister, when we were dealing with the COVID-19 pandemic, he said, it's obvious, let's just be clean. If we are clean, if we are washing our hands, we'll be out of this pandemic. And it sounds, like a, very go figure kind of statement. But one of the things that he's a champion of in the ministry is, Mercy, can we just have a sanitation index in this country? Can I just get up today and say, this county is the cleanest and this is the dirtiest county, and then let it all rip, if you know what I mean politically, because he believes sanitation is center stage. And really, again, when we're discussing climate change, sanitation is center stage. It's one of the things that we need to look at. And so after trying to earn my promotion, let me introduce the Cabinet Secretary, Senator Mutahi Kagwe, to stage.
Okay, Mercy, it's all done. You can go home in peace knowing that the promotion is on. Good afternoon. Is it evening? Good afternoon, ladies and gentlemen. It is always a pleasure to be here. I think yesterday we were here on a different subject, but I want to say two things. There's always two things. Two things before I begin. First is that climate or climate change or climate support is something I am extremely passionate about as a person, as an individual. Besides wearing the hat of Cabinet Secretary for Health, I am a tree farmer. My passion and my pastime is to grow trees. And I have a lot of them, I can tell you that. And when I grow trees, which is the second part of my remark, I started off by growing trees to make money. I grow a tree so that I can sell the tree and make money. Then came a problem. I couldn't be able to cut the tree. So I could not make money with the tree. That is why I don't look rich. So anyway, I would like to take this opportunity to recognize the World Health Organization Director, Department of Environment, Climate Change and Health, Dr. Maria. Ladies and gentlemen, distinguished guests. Let me begin by saying that it is an honor for me to be here this evening, to appreciate the strides that we have made in the interface between health and the ongoing climate change, and indeed to reflect on these matters in order to gain clarity on our way forward. Let me start by quoting a world-famous Kenyan, Nobel laureate and environmentalist, and my neighbor, the late Professor Wangari Maathai, who said, and I quote, "Mother Nature is very generous, but can be unforgiving," end of quote. Professor Wangari Maathai's words were true then as they are true now, because individuals, communities, private and public corporations continue to attack Mother Nature in a most vicious manner, and there is no question that Mother Nature will respond in equal or greater measure. Notably, the health sector remains the most vulnerable and the worst hit from the negative impact of climate change. And why do I say that? Because two things happen. As I said, there is always two things. One is you go hungry because you can't grow anything. You can't grow crops because it is flooding, and you can't grow crops because it is too dry. So we go hungry. And then when we go hungry, we get sick. And when we get sick, there is no peace. So world leaders have recognized the ongoing and potential catastrophe that climate change is impacting on our health. In January 2022, the Glasgow Climate Pact reaffirmed countries' commitments to limiting global heating to about 1.5 degrees centigrade. Therefore, without prioritizing health, economic equity, and multi-sectoral engagements within the climate action, the health of the entire planet and the future of humanity remains at grave risk. And it always occurs to me that explaining to people about climate change is a little bit like explaining to somebody that you have a stomachache and they don't. You can do all the explaining you're doing, but you'll never quite feel the pain. If you don't have a stomachache, you can't feel pain. So it always occurs to me that when you talk to people about climate change, it is as if they are hearing you but can't feel it. And consequently, we need to make people feel it. They need to feel what we are saying. Ladies and gentlemen, in my own country, Kenya, the dichotomy of drought, flooding continues to wreak havoc on people's lives and livelihoods. On the one hand, the reduction in rainfall and the current drought is ravaging the northern parts of Kenya and pose a risk by negatively impacting nutritional status of the population, increasing chronic undernutrition, and increasing transmission of vector-borne diseases. Furthermore, the impact on pregnant and lactating mothers who are especially vulnerable to changes in food availability and undernutrition increases the incidences of low birth weight infants. On the other hand, flooding has caused an increase in waterborne diseases, especially impacting the under 5 years old children. To this end, Kenya is undertaking proactive surveillance activities of disease such as cholera to ensure that a mounted response is achieved in a timely manner. The Kenyan picture is replicated across the world, and therefore this requires global synergies to halt and reverse the negative effects of climate change. This can be achieved by resource mobilization, political advocacy, and commitment to have action and responsibility taken at local and community levels. In this regard, I would like to recognize especially the efforts of our neighbor and East African community partner, Rwanda, in successfully implementing a community-led environmental health program that is centered on the principle of political commitment, resource mobilization, individual responsibility, and community action. Kenya is learning from exemplars in this field and can attest to the significant impact that our efforts in environmental health during the height of COVID-19 pandemic had on communicable diseases. We cannot divest from sanitation and hygiene as a cornerstone of a healthy nation, and it starts with individual responsibility. We all have personal responsibility to keep our immediate environment clean. Sadly, examples of individual irresponsibility coupled with poor government enforcement are evident, and these have led to propagation of preventable diseases which require resources that would otherwise have been utilized to combat other disease areas. And in this regard, Kenya is hosting this side event to catalyze political commitment and advocacy and drive discussions on how we, especially from the sub-Saharan Africa area, can develop homegrown solutions with maximum impact. Ladies and gentlemen, the lure of healthcare experts cannot be understated. And it is this time that the health sector took center stage in collaborating with new line sectors to drive the interventions aimed at mitigating against the negative impact of climate change. Indeed, we can no longer sit at the sidelines and wait for these adverse climate events to happen, but rather to ensure that our collective effort can realize the changes we need to see at the shortest possible time. Ladies and gentlemen, as I conclude, let me reflect once again that the theme of the 75th World Health Assembly puts it across that, and I quote, no peace, no health, no health, no peace, or rather the other way around. But we must remember, as has been ably mentioned elsewhere, that peace is not necessarily the absence of war. And when we attack Mother Nature with all our weapons, and those weapons include cutting down trees, polluting the air through our factories, etc., etc. When we use those weapons to fight nature, then nature, as I mentioned earlier, must defend itself. And it will defend itself through the kind of things that we are noticing today. And my view is that if this continues, there will either be one of two things. Either A, there will be no human race, or B, there will be a human race that will not look like us. Because it will have to adopt and adapt to a completely different thing. Perhaps they'll grow 2 feet of hair to protect themselves from the heat, that will be, and people like me will be a threatened species. So, so the long and short of it, in my view, is that it is either A, we are at peace with nature for real, and that at the very least, if we do not want to protect nature, can we at least leave it alone? Because it is like adding to insult to injury. You not only want to leave it alone, you want to destroy it. At the very least, leave it alone. Maybe then it will leave you alone. But if we attack it in the manner in which we continue to do, then I promise you, there will be no peace. And if there is no peace, no health. Or at the very worst, peace will not mean the absence of war. I thank you sincerely.
Fantastic. Good afternoon, everyone. Dear Minister, it has been really a pleasure to hear you. You said that there is always a question of two things. If you allow me, I will add even another one. It's just the two basic things. I mean, you were saying that during the pandemic, we were telling people something as basic as wash your hands. Where? If you don't have sanitation, if you don't have water, where do you want me to wash my hands? So it's so basic that I have the impression that we are losing contact with the basic. And you say we are attacking the earth, we are attacking nature. The first recommendation from a public health point of view that we need to do to our citizens is please stop war with nature. Please stop destroying ecosystem. Who is giving us food? Who is giving us water? Who is giving us the air we breathe? Nature. So we need to stop this stupid war on earth. First of all, because we are the losers. I mean, if we go on a battle with nature, clearly we will be the losers. So thank you very much. And Dr. Mercy, you said it was no self-promotion. It is more than that. It is more than that, and it's good. What we would like to see is healthy competition. So you are now setting the standards very, very high in Kenya, We want others to follow, and we will compare and we'll say, yeah, you are not good enough. And I hope that this will stimulate much more action. Again, thank you very much for being here this afternoon. I see that there is many people committed and interested. And when a minister of health talk about climate change and health, and they say that we are very much committed to that, for us, proof that this is irreversible. It took us a long road to reach the COP26, where health was very, very prominent. Not that we were not there before, but finally, I think health is emerging as the real motivation to do something about climate change. You say it very well, Minister. Many people don't see the connection between climate change and our health. But when you tell them about asthma cases and air pollution, they see it. Or when you tell them, well, if you cannot cultivate, then you will be hungry. And if you are hungry, of course, everything will follow. So, or if you have a cyclone or you have a flooding, you will not have drinking water. So we are talking about two things, very basic ones. So let's reinvent something called common sense, okay? Let's reinvent it this afternoon, revitalize that concept. Public health is all about primary prevention. So all we are doing here is nothing else than a fantastic opportunity by addressing environmental health determinants to do the massive primary prevention ever. And thank you very much, Kenya, for starting this movement that I hope that we will create many other self-promoters that wanted to imitate you and go for even more and leave you low, and they will be very high. So that healthy competition, we are very happy to go for it. Let's talk about this fantastic Pan-African multilateral partnership. It's clear, Africa will be very much affected. Yes, Africa will have a big proportion of the vulnerable population. Yes, you are not the most important responsible for what's happening, but you are probably the ones that will be suffering the most. That is true. Let's not concentrate on these negative facts, and let's look at, so what next? What do we do now? What are the opportunities? And this is the reason why we have this panel. Let's talk about opportunities for this Pan-African engagement partnership. And I'm very lucky to have 3 countries competing for this leadership role. So the competition starts now. I will invite Dr. Halil Abdel Shafar. He's the Minister of Higher Education and Scientific Research in Egypt. Okay, no competition with Egypt. Well, well, Egypt, as you know, will be hosting the COP27. So I'm sure that they are in the race and they are competing very much, but probably they are somewhere else. I see an Egyptian representative, but not from the government. So I will not put you on the spot. Don't worry, too young, but soon I will put you on the spot. Then I have another country who is on the race, is Malawi. And I have Doreen Ali, Deputy Director. Doreen, please, Doreen, join the panel. And then, of course, we have another panelist from Kenya. We have Anthony Bainatan, the Director of Public Health, Ministry of Health, Kenya. Anthony, please have a seat. So we have 2 countries, 2 ministers of health, and a great opportunity to talk about this multilateral partnership, climate change and health, environmental health in general, opportunities. How can we use this example, this Pan-African multilateral partnership, and learn from other partnerships that exist already? In one word, how can we scale up the work on climate change and health, and doing as what the minister was saying, for people to understand that this is very much about their health, and that they should not destroy nature, but at least don't touch it and give it alone. So leave it alone. So can I start with you from Kenya to follow up on the great speech? What do we do? What are the opportunities that you are seeing?
Yes, please. Thank you. Yeah, we have a number of opportunities that are available to us, generally as Africa, and I think worldwide. First of all, we have political will, as we speak, is quite high in Africa. there is a committee of heads of state that drive the agenda on climate change. In addition, we have some economic blocks that actually come together on which we can ride on and articulate matters related to climate change and health. This is in cognizance of the effect that that most of the Africans would be adversely affected by this, and there have been new cases of diseases which were at one time considered controlled, and as such, I believe that these particular opportunities give us a very good opportunity to do that. We have something like the first ladies have a forum where they meet, and even though that their forum was actually started in terms of HIV/AIDS, it's very easy to incorporate the issues of climate change and health. We also have, like the East African community. The East African community brings together the heads of state, even professionals join in that, and they're able to articulate their matters. We also have the what we call IGAD, Intergovernmental Government on for the Horn of Africa. The same, the heads of state and other leaderships, including ministers for health, they have been able to meet and articulate matters related not only on climate change, also on environment and health. At a professional or at the technical level, we have what we call the HESA, Health and Environment Strategic Alliance. This brings together several members who come together from the Ministry of Health and Environment, plus even other agencies. And it's important to point out that the Ministry of Health should be viewed as an administrative unit to actually coordinate issues of the health sector, where there are many players like transport, agriculture, energy, and this quite can go on like that. Thank you.
Yeah, thank you very much. I'm sure you all know that the Libreville Declaration and those strategic plans that you were referring to is maybe another a model that we need to revitalize a little bit and use it. The idea is to put together the different ministries and sectors to talk, but the health sector needs to take a very important role. This is the strategic alliance you were describing, no?
Yes,
very good. Doreen, can I call you Doreen?
Yes,
is that okay if I call you Doreen, and Anthony?
Yeah, Doreen
and
is
Maria. Fantastic. Very good. Doreen, what's your experience in Malawi? Is this climate change and health recognized? Are you having difficulties on participating on dialogue about climate change? Or what are your experience or your proposed opportunities to scale up the work on climate change and health?
Thank you very much. For me, I think I'm here on behalf of our Honorable Minister. She was supposed to be here, but she's got other pressing issues, and I'm here on her behalf. As for Malawi, we are doing a lot of work on climate change. And as of now, we are battling with so many issues. We had so many, disasters that hit us. They die, and also the other, storms that affected the country, like the lower part of the country. And with that, we had so many issues. We had now we are struggling with the diarrhea diseases, the cholera, which we are struggling with. And we have got so many issues, like with a lot of, floods. We have a lot of, water logged areas, and the malaria burden is very high, especially in the lower, part of the country. With that, that means even if we put interventions in those areas, it's hard to come by because like the malaria burden is so high, the mosquito are building a lot, and the cholera is there, and it's like the communities are really suffering. But for us, we, as of now, currently, we are developing the health sector strategic plan 3, where we are embracing climate change as our priority in country. And we are going to be working with the private sector, and the community aspect is very high because we are going to be engaging the communities to help us to how to mitigate the effects of this climate change, and also to do more of the preventive measures. As a country, we are trying also to ensure that we do a lot of use of diesel oil for our generators. So we are in a mission to put in our health facilities the solar systems, in the hard to reach area, so that we can reduce the emissions of carbon. So now for the country, we are working with also different partners to ensure that we work as a team to ensure that we embrace these issues. And this is really a priority, not also only for the Minister of Health, but also the other related Minister of Forestry, Minister of Agriculture, those water. So we are working together to ensure that we can mitigate together the effects and the issues to prevent issues of climate change.
Doreen, you mentioned the problems you have with vector-borne diseases and diarrhea and cholera. Do you see that, I mean, are you investing enough on water and sanitation as one of the key determinants for having diarrheal diseases and cholera? Or still, in some places we see that it's more easy to respond and treat the cholera patients, but we don't invest enough on the causes of cholera, which is lack of sanitation, lack of safe water. So is the Ministry of Health empowered enough with other departments and then having the opportunities to ask others to invest on something that will generate a massive benefit for health? Or
yeah, sometimes we have a challenge. Like now we had the floods, bad ones, because the storms are so heavy, and you could see that the whole part of the district is washed off, and there's water everywhere. And you could see, where do they go for the sanitation water? Where can they get clean water? So now we are trying to invest, because it's like the whole village, you find that it's all washed out, meaning that everything that was down came up. The latrines, the water system is not there anymore. So now we are trying to put it back. So we still need to work with other partners, the government itself, to make sure that we provide good water sanitation and water supply. It's not like done now. It will take a little of time, but still we need to make sure that we embrace that. Because and if you go now to the lower Shire, we call it lower Shire, you find it's a very difficult and challenging situation, especially on the water and sanitation. And you could think of the mothers, the pregnant women, the healthy sector, the deliveries. You think all that, to see that how can we help them as soon as possible. I had an opportunity to go down to, to see what to help. We went around with the other partners to go to the sites. You find that the health facilities, they are waterlogged. That means everything that was there is you can't use. And some of the toilets, they are submerged, meaning that it takes a lot of investment to put the infrastructure back, and also the water in the communities. You have to go back and through. So now they are refugees in their own country. They are out in the, out of their homes. Yeah, and we are trying to make sure that we go back to make to develop their communities again with their support. So it's still a very challenging situation.
So clearly investing on climate change prevention and
we need
tackling the causes of climate change will prevent all of that, because it's basic public health. There are several partnerships and initiatives in Africa, because this is for an inter-Africa, pan-African multilateral partnership. There are different initiatives like the First Ladies Group and the Horn of Africa initiative and others. How do you see the collaboration, Anthony, on those partnerships, or you see more opportunities, or how can we integrate SDGs, Alliance, and things like that? So how do you see that?
Yes, actually, those fora offer good opportunities. And one thing we can do about it is to make the aspirations of those fora to be really on the ground with especially the government workers. For example, we could ensure that the development strategies and documents incorporate issues of climate change and health. And specifically, I would like to say that as we speak now in Kenya, we're already doing that. We already have a team working on that to ensure that in the next 5 years, this becomes a real agenda in the development of Kenya. And before then, we have what we call the Vision 2030. And the recognition of that relying on climate-sensitive economy actually would adversely affect the performance. And we have seen from COVID that there is no or minimal difference between economy and other spheres of life, including health. So integrating this one in bringing into the different development frameworks would really become something else that would make it integrated into day-to-day work. In addition, allow me to say that there is what we call in the civil service in Kenya, it's called performance management. This is where different staff come up and agree on their area of work. They will have different deliverables. And this area on climate change and health is one area that we can very well cascade to individual, to departments, to individuals, such that it is reported routinely, both at the department or strategic level and on individual level. That way it becomes very useful. The other thing is that we have a very robust relationship with our partners, the private sector, civil society, such that every time we meet, we are able to actually compare what is the government agenda, where can each of these partners come in and supporting and move forward. So it is a very good working environment for Kenya to advocate and actually propel this idea and agenda of climate change and health. Thank you.
Thank you. Minister, you mentioned as an example Rwanda. And last week, it was a big meeting in Rwanda I had the opportunity to attend, which was on sustainable energy for all. And again, the data tell us that the continent where a biggest proportion of population without access to clean fuels for cooking or lighting or heating the house is in Africa. So yet another issue that is putting at risk our health. If you are cooking with polluting fuels, you will be sick and you will generate this pollution, and it's really putting at risk health. Do you think that this type of big partnership on accelerating access to clean energy and allowing for investments coming from the climate change negotiations, do you think the health sector is well represented, or they try to exclude us a little bit? And because the health sector is always so busy with so many competing priorities, maybe we are not representing in those fora where we can maybe obtain more funds. Do you see a solution to that, or maybe opportunities to change that? To the two of you, I mean.
Yeah, I would, in Kenya, what has happened is that we have actually appreciated that. And we have a technical working group whereby we bring together the Minister of Environment, Energy, and Health. And the Minister of Health is the convener of this technical working group. We meet on quarterly basis, think about it. And one of the things that we have been able to do is that we have come up with the first collaborative research or study to determine and articulate the matters that affect climate change and health. In regard to indoor air pollution, again, the Minister of Energy has worked with us very closely in the adoption of clean energies and technologies. Just last week, we finished training our community health volunteers in our 47 counties on indoor air pollution, whereby they will be the advocates for uptake of clean cooking. And as from clean cooking, we're able to avert not less than 26,000 deaths in a year in Kenya attributable to indoor air pollution, which we consider is a real loss to the country. Yes, so we think and we know that in Kenya we are actually playing our rightful place, but there is always room for improvement, and we are always in consultation and discussion with all the ministries which are concerned.
So we will never accept that the Ministry of Health is not represented. This is our business. Climate change is the health
Yes.
sector business very, very
Yes.
much. Doreen, you wanted to intervene.
Yes, I think for the Ministry of Health, we also working with our partners. We also have similarly the technical working groups that we incorporate other partners, including the other government departments, like what I've said, the water department, the Ministry of Forestry, because the forestry, that's where the wood comes out and the charcoal. So we work together. And even the energy, Department of Energy, we also work together. Like now we are working closer to make sure that our facilities are solarized. Yeah, so that's a big project. And with the other partners that are working with, we work together to make sure that we have a budget line so that we put the solar in the facilities. But we still need to do more, because sometimes we might think that we have finished whatever we are doing. That's why when we are developing the health strategic plan, we also invite the same partners so that we don't forget anything. So we don't want to leave anyone behind. But the main issue is to involve the communities. If we engage the communities, we might have funding, but if it does trickle down to the community where the issues are, we won't win. So we need to embrace the communities. They have to take this as their own. They have to participate in everything that we do. Otherwise, if we forget them, in the process of planning, we will not win. So for us, we have to gear to make sure that the communities are involved, all the partners are involved, the private sector are involved, including the development partners, and we might win this battle.
We are going to win.
Yeah.
There is a second very good panel, so I will stop here, but very good messages. The community, the electrification of the healthcare facilities, indoor air pollution, the Ministry of Health being present in all negotiations about climate change, and even be ready to receive some critical funds from that. Thank you so much. Let me ask you for a big applause to the panelists, please. Thank you. Thank you very much. Yes, I was on time. Thank you.
For such an insightful, engaging, mind-blowing session. We've had quite a number of initiatives, a number of declarations that have been previously mentioned. And now this session will really put young women, older women, women of all color to the center, and also focus on youth and how health and climate change impacts on them. My name is Liz Ntonjira. I'm a youth champion and the Global Communications Director at Amref Health Africa. And with me, I have such an amazing panel that consists of, please do come to the stage when I call your name, Dr. Jenny Miller, the Executive Director, Global Climate Change and Health Alliance. We have Lucinda O'Hanlon, Head of Policy and Strategy at Sanitation and Water for All. And we do have a virtual panelist, Dr. Edward Mungai, who's the consulting partner at the Kenya Climate Change Innovation Center. And we do have an exciting and very engaging panel, audience, virtually. Over 200 people are joining us. So thank you so much for joining us. We've had Doreen from Malawi speak about communities and the importance of putting the community first, because this is where young people, this is where women, this is where vulnerable communities are when we're speaking about health and climate change. Let's have a video that will really put this into context and set the tone for this panel discussion. Video.
Kwa majina ni Jane na Shibai Matule.
Kwa majina ni Elizabeth Masigonde.
Naishi Olokuto Senda. Nafanya kazi ya community health volunteer.
Nimefanya hiyo kazi kwa muda wa miaka 10.
Anga inapobadilika, tunakuwa na shida ya maji. Mito ni mbali sana.
Kulingana na venye tulikuwa tunafuna mavuno imebadilika. Juu wakati mvua ilikuwa inaanza, huwa tuna time ati kutanyesha mwezi fulani na hainyeshi, huwa tunachelewa na kupanda, nayo inatuadhiri kwa sababu hatutime vizuri wakati kunanyesha. Sasa mvua inakatika wakati mimea bado iko kwa shamba, kwa hivyo kuna changamoto ya maji.
Watoto wasichana wanachelewa, wanakuta vijana wako huko wanashuma, wanapata mimba ya mapema.
Mzee akishaenda kazi zake ananiwachia mifugo na ni mpaka niwapeleke maji. Nikishawapeleka maji, kama hakujanyesha, mpaka niende na punda nikuje na maji, na niko na mtoto kwa mgongo.
Tunahitaji maji safi ikuwe karibu na manyumba zetu na maboma zetu ili tupate maji ya kutumia, kwa sababu saizi unaenda hiyo mtoni unaleta mtungi 2, na hiyo mtungi 2 ni kidogo wakati ya korona. Maji ya kuweka hata hiyo mitungi uoshe mikono hata hakuna. Hata mtu unapoingia choo kutoka, huwezi pata maji ya kuonawa mkono. Yaani kupata maji ni shida.
Siku ya kuchota maji hakuna kazi ingine, ni kuja tu kupika, hakuna kazi ingine utafanya. Inabidi niamke mapema na inachukua muda mrefu. Ukienda kuchota maji na kurudi tunatumia karibu 4 hours.
Unakuta hata hiyo maji imechafuka mtoni, unakuja kuchota unaleta ugonjwa.
Wamama ndio wanaathirika sana kwa sababu mzee akishamaliza breakfast yeye anaenda shughuli zake. Sasa hataki kujua kama mtoto alipikiwa chai akienda ama mlipata maji.
Mimi kama CHV nikienda kuangalia watu, kutembelea maboma zao, kama wakati huu wa kutembea kuangalia machoo na mazingira, tunakuta ako na ugonjwa, anaumwa na tumbo, anahara, na hiyo yote ni shida ya maji. Hata unatembea unachoka, hata ukiingia kwa boma kuomba maji unapata maji chafu yenye hata ukikunywa unaumwa tena, hata wewe unapata shida ya tumbo. Maji ni maisha na maji ni uhai. Tunapopata maji safi, maisha yetu itakuwa mzuri. Tutapata maji ya kutumia kwa nyumba, kulima. Tutapata hiyo chakula. Wasichana hawatapoteza wakati ya kwenda shule. Tutaendelea kama nchi zingine.
The realities are grim. We are discussing it here, but people are living and experiencing it. And how do we come up with the solutions? Jenny, let me start with you. Tell us about your experience in bringing together and coalescing civil societies to address such barriers and any other barriers that we've not seen in that really touching video.
Yeah, thank you. So a little bit about the Global Climate and Health Alliance. It was founded about 10 years ago in order to bring a strong health voice to the climate conversation. And it came from health organizations that were starting to become concerned about climate change, but didn't see the impacts on people being articulated in the climate discussions and being addressed in the climate discussions. So the Climate and Health Alliance is made up of health organizations from around the world that work together on this issue. You started out by mentioning youth and women and the particular impacts there. From the get-go, we recognized that it was really important to have youth representation at the table, to have women's leadership, to have health equity, gender equity, and these kinds of things at the center of bringing this issue to the international community. So from the very beginning, medical students have been on the board of directors of the Climate and Health Alliance. We also, I guess it's 3 years ago now, joined with the World Health Organization to, we were invited to form the WHO Civil Society Working Group on Climate Change and Health to really strengthen the collaboration with WHO, between WHO and civil society, again, to bring a stronger voice on this issue to the global stage. And I think we've really seen some of the power of that collaboration just last year we together spearheaded a letter from the health community to national leaders that were going to the COP negotiations and to the negotiators that called for action in climate change to protect health, to address the impacts on health, also to ensure that the solutions really protected health as much as possible. And that letter got signed on from over 600 organizations around the world, health organizations around the world, representing 46 million health professionals. So that's around 2/3 of the health professionals of the world. Some of the barriers that I see, I think Maria Nera mentioned a couple of them, the two things that I would highlight as well. One of those is, health professionals and health workers and the organizations that are from the health sector have many, many competing demands on their attention and on their time. I think the thing that has changed in just the last few years is that as the health community, we're now realizing we must step up. The impacts of climate change are so significant, and they're going to touch every other aspect of the work that we do, that we have to bring the health voice to the table to make a difference. And then the other barrier that I would note is that at those climate decision-making tables and the multi-sectoral, the other sectors where key policies are decided on that have an impact on climate change and health, health is frequently not at the table. We often don't see health leadership there. So that's why kind of collaboration, partnerships such as the one that is being founded and launched, civil society collaboration, I think that's so critical in order to bring a more powerful voice and really come together with a voice on this issue.
You've mentioned quite amazing things, but two things stood out for me. One is the fact that there are young medical doctors in your board, which I encourage you all to have, young representation within your boards and senior management in your organizations, because then it's very inclusive and everybody has a seat at the table. The other thing you've mentioned is on the competing priorities. And it's quite unfortunate that early this year, I think in February in Malawi, the first case of polio was registered after 5 years of it being declared controlled. How then, Lucinda, I'm coming to you, based on this, we're really dealing with sort of like a triple crisis. We have health, economy, and climate, and we've seen it play out very well and contextualized in that video, and also what Dr. Maria's panel did mention, including the minister's speech. How then can we coalesce different organizations? How can the global community come together to address these challenges?
Thanks so much for the question. Good evening, everyone. So just to start by describing a bit about Sanitation and Water for All, we're a UN-hosted global partnership that works to elevate the prioritization of water and sanitation in national and global agendas through multi-stakeholder action and system strengthening. And we know, I think we've heard it from the other panelists that water and sanitation are prerequisites for good public health. And the COVID pandemic was a good reminder of this. As Maria said, we're being told to wash our hands, but where? I think we need to remember that still 1 in 4 people doesn't have access to clean water. Over half the world's population doesn't have access to a toilet. And during the pandemic, 3/4 of the population of the least developed countries did not have access to basic hand washing facilities. So these are really jarring numbers to think about. And climate change, of course, is making it all worse. With climate events, we are faced with situations where we have more water, too much water, or too little water. And that has ripple effects across all dimensions of our lives. What we're trying to do through our partnership is to work across sectors. And just last week, in fact, I'm fresh off the plane this weekend, we had a ministerial level meeting in Jakarta. We had over 350 participants. over 50 ministers from 57 countries. And for the first time in our high-level meeting, we didn't only invite the ministers of water and sanitation. We invited the ministers of health, of environment, of economy, and they came. We had delegations, sometimes of 3 or 4 ministers, all from the same country, for the first time sitting together in a global meeting. And they were able to exchange on the strategies that they're adopting, on the challenges that they face, speaking directly to each other in order to come up with sustainable solutions. In the discussions, it was recognized that water and sanitation are indispensable for prevention of future pandemics and public health emergencies, that it's integral to support economic development, not only by keeping people healthy, but through creating jobs and supporting innovation, and that it's imperative for communities to be resilient to the impacts of climate change. Throughout those discussions, there was also a strong focus on inequalities, recognizing that those who are already suffering discrimination in so many different ways, the pandemic, climate change exacerbates all of that. We saw with women during the pandemic that women shouldered the burden of care, either as frontline health workers, the majority of frontline health workers are women, or as caregivers at home. The video very powerfully showed the impact of climate change and water becoming scarcer, and women having to travel even further distances or having to use dirty water to serve their families and risking making their family members sick. I'm talking about a meeting, but it's more than a meeting. It's a process. And the preparatory process to arrive at this meeting created an opportunity for our partners at country level to come together, to establish inclusive and participatory platforms, and to sit together and think what's working well, what's not working well, and how do we come together to address that. And partners came to the meeting with then concrete commitments, intersectoral commitments. The commitments, for instance, related to building capacity of the authorities to work at the intersection of climate, health, and water and sanitation. There were commitments to integrate water and sanitation into climate adaptation plans, national adaptation plans, to increase the number of health facilities that have sustainable access to water and sanitation. So those are the types of things that countries were coming up with. Youth were also actively engaged in the preparations for the meeting. They got together ahead of time and developed key messages to bring to the ministers at the meeting. At our closing ceremony, a 9-point action plan was presented to the ministers by our youth representatives, which really emphasized their priorities, that we need to work hand in hand with them as agents of change, that we have to have a priority focus on addressing inequalities, on understanding water and sanitation as a matter of social justice, and the need to seek transformative solutions. I'm going to wrap up, but I don't want to finish without saying what are some of our key takeaways were from the meeting, which were in the outcome document that was shared. So first, there was agreement that we need to implement reforms to ensure stronger enabling environments. What does that mean? It means reforms that would facilitate greater intersectoral action, that would ensure good governance is in place so that as we seek to build stronger water and sanitation systems, that they flourish and don't collapse because they're not maintained properly. There was agreement that we have to insist on accountability as a central tenet for accelerating progress. We see accountability not as a naming and shaming function, but as a way to ensure multi-stakeholder action, as a way to convene people to have honest reflections on what's working well and what's not, and to take corrective action. And then finally, and the Honorable Minister said it very well, and in the previous panel, we need political will. And that, we think, is the magic ingredient for progress. When we understand water and sanitation as matters of social justice, we create the urgency that's needed for that accelerated action. So we're looking forward to taking forward these messages to COP27 in Sharm el-Sheikh, to other global processes, but our partners are also taking this forward at national level to deepen those intersectoral linkages in order to make better progress. We only have 8 years left until we're supposed to deliver on the SDGs. So we have to do better and do more together.
And we need to walk the talk.
Absolutely.
Absolutely. Thank you so much.
Thanks.
Those are really key, important takeaways. And I really like the aspect of looking at the vulnerable communities, youth and women as agents of change. And I really like that you brought into discussion or into play the role of innovation. And the private sector thrives a lot on innovation. And that brings me to my next question to Dr. Mungai, who's joining us virtually. So the question I have for you, Dr. Mungai, is what does meaningful youth and women engagement look like? And what are some of the things that the private sector can undertake to ensure that everybody is on the table when we're talking about health and climate change? Over to you, Dr. Mungai.
Thanks, Louise, and I hope you can be able to hear me clearly.
Yes, we can.
All right, thank you for having me, and good evening from Nairobi. And, it's a fantastic question that you put there, Liz, but I would, as Minister was saying there, that there is always two parts of a story. So the first one is obviously looking at climate change as a threat. We are oftentimes told that in 21st century, this is the biggest disaster which is facing humankind. On the other hand, it could also be an opportunity. And I'm here to represent, that view that it could also be an opportunity for our young people and for our women. And, to just give a little bit of context into this conversation, I'm coming from a situation where 12 years ago, I had a real challenge with my mother, who is partially blind, out of cooking in a dirty kitchen, smoke-filled kitchen, which then I was trying to figure out for a solution, and something which, was about a health problem turned out to become, a climate change solution. And how did we go about that? It's just by including the young people of Kenya and the women of Kenya to provide their own solutions to the menace of climate change. Fortunately, the World Bank was there, gave us $4.5 million in 2012 to figure out how can we, in an innovative way, support the young people of Kenya to come with market-based innovations around climate change and hopefully solving some of the challenges that we are seeing on that video. Now, fast forward 10 years later, we have, close to $70 million US, which is going to support the young people and again, the women of Kenya, meaning that there must be something that, that is happening, and they are coming up with solutions that are helping us, to address that nexus between climate change and health. And what is this? Well, of course, it needs to be development unusual. I think if we treat development normally, it will treat us abnormally, I should say that. And what does that exactly mean? Is that we must be oriented towards innovations. And as we talk about solutions that you're providing, it doesn't need to be plain vanilla solutions. It needs to be innovative solutions from the technologies that you're using and even the delivery, that and how products are provided into the market. And young people of Kenya are eager, and as is the Silicon Savannah where everybody wants to come up with new innovations that can be put into the market. The question is, what mechanisms do we have to support those solutions? Because clearly, I can tell you there are a lot of solutions. The problem is we do not apply ourselves, and I think that's why the question is coming about, what is it that we can be able to do to enable more young people of Kenya to be able to get into that space where they can be able to come up with solutions. And not only in Kenya, now we have established, a brand new institution. Kenya, KCIC was looking at Kenya. KCIC Consulting now is going Pan-African and trying to come up with solutions together with AMLEF that will be able to address this gap. Of course, it's also about looking at financing. It's not about, again, plain vanilla financing. We must look at innovative financing mechanism, which can take kids and young people and women who have an idea. We provide them with proof of concept, take them to seed funding, take them to impact funding, and then scale them and go to corporate funding. And that's how we are going to replicate, the various solutions. Of course, the enabling environment, and I must say, government of Kenya have been very progressive as an example, providing that enabling environment that enables young people and the youth to come up with innovative solutions, which they can be able to put in the market. Because we all know that innovation is always ahead of policy, and you can have a brilliant product, but unfortunately, you cannot put it in the market, yet the government is listening. And once they listen, they can't be able to allow such products to be able to be, mainstreamed into the market. And this is what we need to see. This is what we need to see in more markets and more countries where that goodwill that is being talked about in the panel is required from the government. Of course, it's also about, thinking about the way, funding agencies and people with money are thinking about providing that money. And I must say, it must qualify to two things. One, it must be commercial orientation, meaning it's self-sustaining, because it's not about giving grants. The idea is that, can we come up with solutions that we provide to the young people and the women, such that at the back of our minds, we have that commercial discipline. With commercial discipline, it is going to resolve, the challenge of, just giving a donation and it becomes sustainable. A good example, we were seeing water there and water becoming a challenge. Is it possible to enable new solutions and new technologies which are coming as a result of water, not to give it as a grant, or rather not to give it as a donation, but to have a commercial discipline and help build a private sector or market-based, solution that then would be able to deliver that solution to the people of Africa and help, therefore, solving the problem. Of course, the other element that is very important is the services that we need to provide to these young people. Remember, they are not necessarily business people. And this is a mistake that we make all the time. Thinking that they are business people, we must be able to walk the journey with them, roll our sleeves, hold them their hand, walk with them, teach them what is to make a bankable business plan, how to make a financial model, who to go for, for financing and what kind of financing. And before we know it, we'll start seeing solutions that will truly address some of the challenges, that are being highlighted. Of course, it's also about, the people with the money understanding the local circumstances, and localizing the solutions, because we cannot expect, a solution which is working in the southern part of Africa to work on the northern part of Africa. It must be customized. And again, this is the platform where this can be done. And truly, I've seen already, conversations between ourselves, KCIC Consulting, AMREF, and probably others who are going to join us as we work towards, the nexus between climate change and health, and of course, government of Kenya, not leaving government of Kenya behind, so that then we can be able to prove that truly there are solutions that can be put in place and we can solve the problems ourselves, provided we are enabled. And therefore, the most vulnerable, the youths and the women of Africa, then can have their own solutions, not only to solve climate change, but also to put a little bit of disposable income into their pocket. And therefore, it becomes, a win-win solutions for all. Thank you.
Oh, wow. Thank you so much, Dr. Mungai, for those really enriching insights. I think a lot of great things have been mentioned by our superb panelists. But what I can mention is that it's all about innovation, implementation, taking corrective action, and all this is brought together by ensuring that we are collaborating together, whether it's the public sector, private sector, and the international development sector. I can see there's so many comments online. It's a really engaging session. Unfortunately, we are time bound. We're limited in terms of time, but thank you so much for those amazing insights. Really appreciate it. And this is a conversation that keeps on going. And we will see what comes up next. So it's not policy documents that just sit on tables, but it's something that we're implementing. Thank you so much for listening. I will now call upon our global CEO, Dr. Githinji Gitahi, to give some closing remarks. Thank you so much for listening.
Well. Mine is just say thank you, because I can't summarize such a rich discussion in 2 minutes. Honorable Minister, Cabinet Secretary Kenya, Senator Mutahi Kagwe, tree planter, tree investor, thank you very much for coming here to promote Kenya. And we've been told we should not be shy of promoting Kenya. We're promoting Kenya. And thank you. I see the Minister of Egypt now is of Health in Egypt. Education is represented. So welcome, sir. And I hope you've picked up something here. We've run out of time, so we would have wanted to hear a lot more from Egypt, of course, because you are hosting the COP27 in November. So we are going to be there. We are coming actually after this meeting. I'll be coming to Cairo. Hope to see you there, but we'll be there in November. So thank you very much. I think the discussions have been very rich, so I can't try to summarize them. I would like first to thank all the partners who are here. You can see them up there, the 180 people who joined us online. I just want to say my father passed away because of chronic obstructive pulmonary disease arising from indoor pollution over the years of cooking and boiling coffee and selling it by the street in Nairobi, as he educated me and others. And my mother has asthma, again, from indoor pollution over a long time. And she tells me that the coffee that educated me, the patterns have completely changed. So she does all the work, and in the morning she wakes up and finds all the coffee beans have frozen because there was extreme kind of a temperature drop at night. And now she can't tell, when to actually harvest the coffee and when to invest in it. So I think, as the minister said, we can't fight nature because nature will win. We'll never win against nature. So this is really the message. I pick key messages. One, we have to stop war with nature. Secondly, stopping war with nature is not complicated, it's common sense. The next thing is obviously that we have to involve communities. Communities are the center, and we have to involve them both on mitigation, on adaptation, both of them. And also that this is multi-sectoral, and I think the messages from the countries are that it's multi-sectoral, it's not health sector alone. And finally, that women are bearing the brunt of this, and therefore gender is critical in consideration of our adaptation and mitigation plans. Thank you very much. These recommendations are going to be taken forward by Kenya to COP27. The president of Kenya is obviously chairing the climate committee at the African Union, and therefore there is very high political commitment from Kenya, and we see that now flowing to other countries, and we look forward to COP27 in Egypt in November. Thank you very much, and thank you for joining us. Thank you.